Good morning, dear colleagues. It is well known that nutrition insufficiency is a serious problem for oncological patients. It can increase the risk of infection, would prolong the hospital stay, and of course will make the treatment cost higher. In our center since 2014, we've been doing the screening of the nutrition status of our patients. This screening encompasses practically all departments of our center. It is done by the medical nurses from the group of the nutrition support on a weekly basis. My colleague already mentioned that the screening of the nutrition support will be done around the following parameters: the height, body weight, the BMI, the mid-upper arm circumference, and the triceps skin fold, and also mid-upper arm muscle circumference, which is calculated using this formula. Also, bioimpedance analysis is done patients who are older than 5, above the age of 5. So here I'm showing the way we measure the triceps skin fold and the very process of measuring it. As for the results of this screening for evaluating patients' nutrition status are entered into the medical chart or the electronic case history. Since 2014, we have entered more than 11,000 measurements. The database has absolute values and percentile evaluation or assessment of the nutrition parameters. We have done the analysis of the results of the screening of nutrition status in our patients in all departments of our institution for 1 year and a half. During this period of time, we have had 428 patients, and you can see the distribution of patients disease entity-wise by sex and age, and see that most patients at admission to hospital had some sort of nutrition insufficiency, and this is seen in the BMI less than 15 and less than 5 percentile. Most patients with nutrition insufficiency we saw in patients with soft tissue sarcoma, 45%. Also, patients who had lower BMI, we saw in them as well the decrease in the circumference of the upper arm muscle, and that indicated to the deficiency of the protein. During this study, we saw that patients on anti-cancer treatment had lower parameters of nutrition status. By week 10 of our study, patients of different nosological groups, we saw nutrition insufficiency in 42 and 48% of cases. Also, patients with malnutrition while on treatment, the BMI correlated with the lower value for the mid-upper arm muscle circumference. Based on our data, we could come to the following conclusions. Most patients, when hospitalized for oncological diseases, have malnutrition status of different degree. While on anti-cancer treatment, we have seen changes, negative changes in nutrition status. This is due to the tumor and the anti-tumor treatment. We are convinced, and from our experience we can see that patients who are given treatment for oncological diseases So they should be given preventive nutrition support so that we can overcome severe malnutrition problems. In our work, we use different enteral nutrition, such as nutrition formulas. They help us in different groups of children. Thank you for your kind attention.